I am joined once again with our main host, Dr. Sant.
Hi, Udit.
Thank you very much for being here.
You're welcome.
I'm your host, Udit. Today we have selected the topic of lifestyle medicine, as there seems to be a lot of distrust or a shift from people's belief in traditional medicine and the pharmaceutical industry. So let's start with the first question. Very simply, Dr. Sant, as a lifestyle medicine doctor, what is lifestyle medicine and how is it different to conventional medicine?
Lifestyle medicine is a new medical specialty. It focuses on changing behavior or changing habit of people to treat chronic diseases rather than treating them with medications or invasive procedure. So the difference is obvious. In lifestyle medicine, we talk about changing behavior only. Do this rather than do that. About food, about exercise, whatever. But in conventional medicine, we focus on treating patients with medicines and operation invasive procedures. That's the main difference.
So in your practice, do you still prescribe medicine?
Very, very seldom. My job is reduce medication.
Yes.
And try to stop it.
So instead of medicine, what are you prescribing to your patients?
Well, actually, I do not prescribe anything, but I be a friend of the patient, coach them practically.
You are a health coach.
Yeah, I wear two hats at the same time as a medical doctor, but mainly as a coach. I would call myself a health and wellness coach. Be friend with them and help them to use their own motivation to change their habits. And that's the main task of lifestyle medicine doctor. So in this practice, I have to spend more time with patients.
Yes, your visits are not 2 minutes or 5 minutes.
No, of course not.
Like a normal average doctor visit.
Actually, there are a structure for coaching that we've got to meet them at least 20 minutes at a time.
Okay.
And something frequent, like once in every week, something like that. And there be a good structure to follow and to assess and to help. Basically, lifestyle medicine is a talk therapy, not a medicine or operation.
Of course. So can you tell us what are the components of their lifestyle that you generally address, the main factors that are involved?
I think in the whole world, globally, we agree that lifestyle medicine consists of 6 components. The first one is diet, food, focusing on how to change people toward plant-based whole food. That's the first component. The second one is exercise. The third one is stress management. And the fourth one is about social connection. Now because of newly emerging evidence, we accept that social connection is one method of treatment of chronic diseases. The fifth one is sleeping. Sleep is a global problem, not a national problem, a global problem. And sleep relates to a lot of chronic diseases. And the sixth component is the toxic substance we bring in from outside, like alcohol, smoking, drugs, and even the medication prescribed by doctors. If patients keep on taking all those medicines for a long time, years, that will create problems to the human body.
There's a lot of side effects to those pharmaceutical drugs as well, especially if you take them for too long and then
Sure. There is one.
You also need a higher dose. You have to keep increasing your dose, right? The same dose doesn't work the way it used to 1 year ago.
One of my patients, he has prescribed medication 25 items to finish in each day.
One every day.
Yeah.
25 pills.
25 items. Some item he needs 2 times a day. So you imagine he spent about an hour to finish medication because he needs a few pills.
Yeah.
And then the water. And he got to rest for a little while. Then another few pills and then water.
Right.
Until he finished 25.
Okay.
That is not lifestyle medicine, of course.
That is the complete opposite of what we are talking about today. Right. We are trying to find a way to get people off medicine and also without medicine become healthier, right? So everyone wants to be healthy. Is that correct to say?
Oh, sure.
But
100%.
many people don't know how to change. So can you tell us a little bit about behavioral change?
Yeah, behavior change is a major component of lifestyle medicine. The biggest component, actually, because lifestyle medicine will become meaningless if people cannot change their habits. So what we call behavior medicine is a biggest part of lifestyle medicine. At the moment, so far we have, in the medical profession, we have tried 102 theories of behavior change. And now only one method that stands out with a very good document of success rate. That method we call a motivational interview, MI. And based on that methodology, there are 3 main components in there to help people change successfully. Component 1 we call intrinsic motivation. I mean, inside the head of the patient, what does he really want? Sometimes or very often, he doesn't know what does he really want. So it's in coaching or in doing the lifestyle medicine, we've got to open up what is in his head. What people really want are their life purpose, basically. Or in another term, it is their passion. That is what people really want. Because bring that up. It is in there, in people's mind, but sometimes they don't know it. We got to use the technique to bring that up. That is the first component, intrinsic motivation. The second component is the fear. The fear of failure. Say, I do not want to change because I fear that people will make fun of me if I cannot do it successfully. I fear I cannot face myself in the mirror, self-esteem, if I cannot succeed in doing it. This fear in medical terms we call the lack of self-efficacy. The wording is a little bit confusing. Self-efficacy means the belief in one's ability to do things. Without this belief, people cannot change habits successfully. That is the second component. The third component is, I would call it life energy. People with life energy, they can do anything. You may observe, if one morning you wake up and you feel very energetic, very joyful, in that day you can do anything. and almost always successful. So how to help people to jack up their own life energy? That is the third component.
Right.
Mhm.
Yeah, I think all of these combined basically are like a change in self-identity, which is what I heard is essential when you're trying to change. You have to believe that you are becoming a new person. If you want to become, healthier, then you have to believe I am a healthy person. And all of those three factors you mentioned, I think, are linked with that, to be motivated, to have self-belief, and then finally also to have that intrinsic motivation and to have that positive energy every day.
Mhm. You mentioned changing identity. When we talk about how to increase people's life energy, I would say there are two levels. In the superficial level, we talk about eating good food, do exercise, get good enough sleep, manage your stress, take breaks sometime, go to nature, take bath under the sunlight.
Yeah.
This is a superficial way to increase your life energy, which of course it works. The deeper way is what you mentioned, changing identity. It's a bit difficult to understand. Let me put it this way. In our life, we have our body, our thought, and our identity. Our identity is that we form it. Identity is a fake thing, we form it that this body with this thought is
This identity.
me. Okay. A man of this caliber who can do this, do that with this principle in the mind. That's what we call identity. To change identity, actually, in our life, in addition to body and thought, there is still another thing we call consciousness. It's kind of observer that can observe the thought. Consciousness is not the thought. It stay outside and observe the thought. If one can change identity from believe that one's thought is one's ego, change it to the observer, to consciousness, then one can do anything in changing the behavior of mind and body.
Yeah.
So change identity is very big deal.
That is the hardest part, right? Like, especially take the example, if you've been overweight for like 20 years in your life, then you just think that I am the overweight person. This is my identity. This is who I am.
Right.
This is how I eat. I don't exercise. This is me. Now you say you want to become a new person. It's a huge change. So I think those were the main behavioral points. I want to quickly ask you, let's take the example. I like the sleep example because you said it's a global epidemic, right?
Yeah.
So everyone knows they should sleep 7-8 hours sleep. Why are people not sleeping enough? Or why is the world having a sleep problem? And so what are the barriers to this change? Or why has this issue come?
We've got to go back to the root of human problem. The root of human problem is that human work as a robot. In response to the stimuli from outside, human will respond automatically based on what we call an automatic circuit. Buried inside, I think millions of circuits buried inside, generated from our upbringing, our schooling system. So we become robot. We respond to everything in robotic way, automatic way. And we cannot step out to observe our response. So people just why people sleep late? Because there are a lot of stimuli coming into their life. And they cannot see it because they are robots.
Right.
And they've got to respond to those stimuli in nearly exactly the same way.
Okay.
And they will not be able to solve this problem if they cannot step out to be what I call to be a consciousness to observe the robotic movement of him or herself. Okay. So this is a gap that you ask. Change identity, actually. It take a lot of practice in awareness, self-awareness.
Sure.
To be able to observe your own thought, observe your own robotic way of response to things. If you can do that, you can change anything in your life.